Hi, this is Brian Kim. I'm going to share with you episode number 8 in the Surgical Instrument Review Series, and I'll be sharing my first impressions and experience using the Oculite iChopper for cataract surgery. And so Dr. Donghoon Nam is the developer of the iChopper, and he's a professor of ophthalmology at the Gachon University in South Korea. He founded Oculite in 2017 and has since received FDA approval of the iChopper. And it's essentially an intracameral endoilluminator with a chopping function for cataract surgery. He published a large retrospective case review series in the Indian Journal of Ophthalmology, which comprised of 433 consecutive eyes in patients, and he stratified them by pupil size, which he called without iris challenges greater than 6 millimeters and with iris challenges less than 6 millimeters. And he found no statistical differences in surgical times or complication rates between the two groups, demonstrating that the iChopper was safe and may help to simplify surgery. Now, Dr. Nam is a vitreoretinal surgeon, and for these surgeries, as we all know, a light pipe is used for illumination. So he developed the iChopper to apply these principles of endoillumination with cataract surgery by making the tip of the chopper a light source. Now, according to Dr. Nam, the chopper is best suited for a horizontal chop technique and less ideal for vertical chopping because the iChopper has an obtuse angle and has a flat, non-cutting tip because the light is projected through that tip. Dr. Nam wanted to know if the double chop and cross chop techniques could be applied to his iChopper, and so he came to visit me from South Korea and was present for my first cases with the iChopper. I used the chopper throughout the day and started with full microscope illumination to practice getting used to the chopping angle and slowly transitioned to having the light microscope completely turned off and solely relying on the iChopper illumination for lens disassembly. And so here are the cases in sequence. So this is the first case. I have the lights on, and this is the actual iChopper. You can see it has this white handle, it's straight, and it's got a light source at the end. And it looks like basically a chopper, like a typical chopper, but instead of being a chopper alone, it has this light source. And that's why it has that thicker handle, and you can see that light source coming from the tip, but it has a flat tip. And so it's a non-cutting flap tip. And you'll see me using this chopper on this first case. So I lift the incision with the chopper, go in with irrigation off to minimize Descemet's trauma. And I'm going to do everything like I normally do for my cataract surgery technique. You can see the microscope light is on as well, but you can also see the iChopper endoillumination coming from the tip. I'm removing the surface epinuchal material, sliding the chopper under the rhexis edge, which is really very easy to see because of the chopper. I'm able to see the rhexis very clearly. And then I turned the phaco tip vertically subincisionally and I fractured the lens completely in half. That's double chop. I placed the chopper around the right heminucleus, hooking the peripheral lens, pulling it centered toward the phaco tip, and that is a cross chop. I get the chopper around the first quadrant, hugging the lens from the periphery, and then crushing the lens between the instruments and then emulsifying the lens pieces. You can see that wasn't a full chop. You saw because of the angle, I didn't get a full, complete chop in that first quadrant. So I lift it up with the vacuum and then I start crushing it between the instruments. So again, because of the angle of the chopper, I'm not able to get an efficient and effective chop on this first case. But you'll see as I go on throughout these other cases, I'm going to try to adjust my angle of chop so that I get a more effective through and through chop. I'm crushing the lens between the instruments and then emulsifying the lens pieces. I'm going to place the chopper around that second quadrant, hooking the peripheral lens, pulling it centrally toward the phaco tip and fracturing the lens against the phaco tip. You saw that it was not an effective chop, and so I go ahead and lift that second quadrant up with some vacuum, and then crushing the lens between the instruments, and then emulsifying the lens pieces. Go ahead and turn that second heminucleus in front of me, gently turning it. Again, I am not familiar with this chopper. It's the first time I'm ever using it. Placing the chopper around the lens, hooking the peripheral lens, and then I stopped and I turned the light off just to see what it looks like. But I did not get a full chop, so I did it one more time, and now I got a through and through chop. I lift that third quadrant up with some vacuum, and then I'm holding it between the instruments. I turn the light off just to see again what it looks like, and then I fracture the lens using mechanical fracturing forces, crushing the lens between the instruments over and over again, and then emulsifying the lens pieces. So again, essentially I'm just trying to get used to this chopper, seeing what it's capable of. It's clearly not the same geometry and design as the Kim double chopper, which I use for most of my cases. I turn that fourth quadrant around, place the chopper around the lens using some vacuum to lift it up, and then I crush it between the instruments and then emulsify the lens piece. Fairly dense lens, not a terribly dense lens, maybe a 1 to 2 or a 2+ dense lens, but I'm able to essentially, without difficulty, disassemble this lens using double chop and cross chop, and then just using some vacuum to lift the fragments up when they're stubborn, and then using mechanical fracturing forces to crush the lens between the instruments and then emulsify the lens pieces. So this next case is a white cataract. I've already used trypan blue to paint the capsule, and then the lights are still on. I will go ahead and lift the iris because there was a little bit of reverse pupillary block. Remove the surface epinuclear material. You can see how clear the visibility is of the dye because of the Endoilluminator. So I'm able to very easily, by visualization, slide the chopper under the rexus edge contra-incisionally, turning the finger tip vertically sub-incisionally, and fracturing the lens completely in half. That is double chop. That worked well. Placing the chopper around the right heminucleus, hooking the peripheral lens, pulling it centrally toward the finger tip, which is positioned deep in the bag, and it's the cross chop. And that one was an effective chop. I kept that chopper fairly deep in the bag. I placed the chopper around that first quadrant, crushing the lens between the instruments and then emulsifying the lens pieces. Turning that second quadrant around, placing the chopper around the lens, crushing it between the instruments and then emulsifying the lens pieces. Turning that second heminucleus in front of me again, you see that I'm slightly turning the chopper, so I'm tilting it more vertical, so I'm able to hug the lens more effectively. When you have an obtuse angled chopper, you have to rotate your hands and turn the chopper more vertical, and by doing it that way, I'm able to hold the chopper more effectively versus it sliding underneath the chopper as I'm bringing the instruments together. Because of the obtuse angle, if I try to bring the instruments together like that and have the chopper in a more horizontal position, it'll slide under it. But by tilting the chopper more vertically, I'm able to more effectively chop the lens material with the double chop and cross chop maneuvers. And so that was a modification on this case. And as you saw, I didn't have as many maneuvers where I tried to chop it, but I was not able to effectively chop it completely. In this case, I was able to get more consistent and effective chop maneuvers because of what I just told you. So again, I'm just very carefully chopping using mechanical fracturing forces to break up these lens pieces and using pulses of ultrasonic energy and vacuum to remove the endonucleus and then the epinucleus. And so now this is the first case with the lights off, and you're going to see again what this chopper is intended to do in a very different way to do cataract surgery. I see nothing else except what's in front of me with this Endoilluminator. It reminds me of if I was in a submarine down in the depths of the ocean and I had only the lights in front of me. So I place the chopper under the rexus edge contra-incisionally, and then I turned the finger tip vertically sub-incisionally and I tried to fracture the lens. I didn't get a full chop on that first maneuver. Again, probably because I'm a little hesitant and a little nervous. Go ahead and perform another double chop maneuver, and then I'm able to separate the lens. Placing the chopper around the right heminucleus, hooking the peripheral lens, and then pulling it centrally toward the finger tip and fracturing that right heminucleus in half, and that is the cross chop. I'm very carefully here, just trying to use the chopper to tease that first quadrant up. Again, I'm fumbling around just a little bit. I'm just being a little bit cautious and then using some vacuum to grab that first quadrant up and then emulsifying that lens piece. I'm placing the chopper around that second quadrant. I don't get an effective chop. And then very carefully, I'm teasing that lens piece up out of the bag with the chopper, and then I emulsify it. I'm turning that second heminucleus in front of me very gently, teasing it and rotating it. And then I'm sliding the chopper under the rexus edge contra-incisionally. You can see that very different type of red reflex. And I have the chopper deep in the bag, and then I'm able to fracture the lens completely in half. I use some vacuum to lift that third quadrant up, and then I crush the lens between the instruments and then emulsify the lens pieces. Turning that fourth quadrant in front of me, placing the chopper around the lens, hooking the peripheral lens, and then crushing it against the phaco tip with another cross-chop maneuver, grabbing that piece up with some vacuum, and then using crushing forces to crush the lens into smaller pieces, and then emulsifying the lens piece. And so again, it's a very different way to do cataract surgery. Because all of the illumination is at the tip, it's a very focused illumination. So the thing that I notice is, unlike with the typical microscope light, you have a kind of full view of everything that's going on, even in areas that you're not working on. But really, this is a very focused light beam, which is really directed towards the action of what you're doing. So when you're doing the chopping maneuvers, when you're trying to execute the different techniques, and when you're turning the lens pieces, you don't really know what else is going on outside of where you are. Now, of course, when I have the light directed towards the back, you can see more of a red reflex. But when I'm actually turning the chopper, as I do with the chopping maneuvers, as I use for the double chop and cross chop, you'll have moments where you have a little bit of a weird light reflex. But again, this illustrates the fact that you have to depend upon your techniques when you're doing cataract surgery. And again, this is a different way of doing cataract surgery, but still, you can still execute the surgery in the way you're supposed to. So this is a soft lens, and there's some hydrodelineation ring. You can see the golden ring there. And then again, I'm going to turn the light off here. So I remove the surface epinuclear material. Sliding the chopper under the rexus edge. You can see the golden ring very clearly here. I'm sliding the chopper under the rexus edge contra-incisionally, turning the phaco tip vertically sub-incisionally, bringing the instruments together. And then I'm able to effectively get the double chop maneuver here, cutting it in half, placing the chopper around the right heminucleus, hooking the peripheral lens, bringing it towards the phaco tip, which is deep in the bag. And then I was able to perform that cross chop maneuver very efficiently and effectively here. Use some vacuum to basically aspirate that first quadrant, and then using the chopper to pull that second quadrant up, and then emulsifying the lens piece. Very carefully turning the second heminucleus in front of me, sliding the chopper under the rexus edge contra-incisionally. Again, here I'm just showing how I'm able to visualize things very nicely, getting the chopper under the rexus edge. I'm also showing that I can see the hydrodelineation mark very clearly because of the Endoilluminator. And so again, it is a different way to visualize cataract surgery. I'm able to see everything in front of me very clearly. I was able to see the rexus edge very clearly. I was able to see the hydrodelineation ring very clearly in front of me. And so that was the end of that case as well. So again, this is now a small pupil. So again, I'm graduating step by step to different types of cataract. This is a small pupil. I go in with the chopper and the phaco tip. I'm removing the surface epinuclear material once again, sliding the chopper under the rexus edge contra-incisionally. You can see the changing of the lighting there. Turning the phaco tip vertically sub-incisionally, fracturing the lens completely in half, and that is the double chop. Sliding the chopper under the right heminucleus, hooking the peripheral lens, and crushing the lens, the right heminucleus completely in half, and that is the cross chop. Using some vacuum to lift that first quadrant up, fracturing the lens using mechanical fracturing forces, crushing the lens between the instruments, and then emulsifying the lens pieces. Placing the chopper around that second quadrant, hooking the peripheral lens, pulling it up with the chopper, and then emulsifying the lens pieces. Sliding and rotating the second heminucleus in front of me, sliding the chopper around that second heminucleus, hooking the peripheral lens, having the phaco tip deep in the bag, and fracturing the lens completely in half. I was not able to get an effective chop, so I keep trying again and again. Again, it's not quite working. Again, probably just because of the angles and just being a little bit cautious. What I'm noticing here is had an asymmetrical chop, and that's why the material is a little bit different. It's like a shelved chop. There was not a vertical fissure of the chop. It's more kind of like a shelved. And so that's why I'm having a little bit of trouble here. But that's okay. I'm able to still place the chopper around the lens and perform multiple chop maneuvers and slowly disassemble this lens into smaller pieces and then emulsifying the lens piece. So again, that's that last remaining part of that third quadrant. I'm just trying to tease it up with the chopper, separating it from the rest of the lens, trying to pull it up with the chopper and then grab it with some vacuum, crushing it between the instruments, and then emulsifying the lens piece. So again, this is a small pupil. I probably wasn't as aggressive with turning the phaco tip vertically, subincisionally when I performed that chop maneuver. And again, this chopper is not really quite the correct angle, but nonetheless, I was able to get through it and go ahead and chop the rest of the case and placing the chopper around that fourth quadrant, hooking the peripheral lens. Some pieces came up, so I emulsified that lens piece, turning it a little bit more, sliding the chopper under the rexus edge one more time, using some vacuum to lift it up, and then crushing the lens between the instruments, grabbing it with some vacuum again, crushing it between the instruments one more time, and then emulsifying the lens pieces. Grabbing that last fragment with the phaco tip, pulling it up with some vacuum, and then crushing the lens pieces with the instruments, and then emulsifying the lens pieces. There's still a small piece of endonuclear material that's trapped there. I manipulate with the chopper and then using the phaco tip to grab it with some vacuum and then crushing it between the instruments and emulsifying the lens pieces. The remainder of this is just the epinucleus coming out. So again, it's a very unusual type of visualization and illumination when you're dealing with cataract surgery in this way. So this is another soft lens with a big pupil and the lights are off again. So you can see I'm removing the surface epinuclear material. You can see I can clearly visualize the rexus edge. I slide the chopper under the rexus edge contra-incisionally, hook the peripheral lens, turning the phaco tip vertically sub-incisionally, and I'm able to fracture the lens very easily in half. Placing the chopper around the right heminucleus, hooking the peripheral lens, pulling it centrally toward the phaco tip, fracturing the lens against the phaco tip like a chopping block, and that is the cross chop. Place the chopper under the first quadrant, pulling it centrally toward the phaco tip and crushing it with the cross chop maneuver, lifting that fragment with some vacuum. It's a little stuck, so I lift it with the chopper out of the bag to crush it and then emulsify it. Grabbing that fragment with some vacuum and then emulsifying as well. Loosen that second quadrant up, placing the chopper around the lens, hooking the peripheral lens, hooking it and crushing it against the phaco tip, and that is another cross chop maneuver. Grabbing that fragment with some vacuum, crushing the lens between the instruments, and then emulsifying the lens pieces. So by this time you can see I'm much more efficient and more confident with the chops because I've adjusted my technique. And you saw that I wasn't whiffing when I was trying to do the chop. I didn't miss getting a complete chop. I was able to get more effective complete chops with these cases. With each successive case, I'm becoming more effective and efficient with the chopping maneuvers. I'm turning that second heminucleus in front of me very carefully and gently. using the fingertip to lift it with some vacuum, getting around the lens with the chopper, and then crushing the lens between the instruments, and then emulsifying the lens pieces. Here what I'm doing is actually a cool maneuver again. I'm getting the chopper under the rexus edge and hooking the lens from the subincisional space. And by hooking it from the subincisional space, I'm able to pop the lens up. And so with this illuminated chopper, it just goes to show it doesn't really matter. As long as it is in chopper orientation and configuration and design, I'm able to hook the peripheral lens in the subincisional area, pop the lens up. And again, you've seen me do that on multiple previous videos where I use the chopper to pop subincisional stuck lens pieces out by hooking the peripheral lens and popping it up. And you saw me do that same maneuver on that last fourth quadrant that was stuck in the subincisional area. And so lastly, I'm just using the Endoilluminator just to kind of look around and just see how amazing the actual visualization of the lens pieces is at the end of this case. So again, this is the first impressions that I have of this iChopper developed by Dr. Nam. Again, it's a very different way to do cataract surgery. Instead of relying on full visualization using coaxial and paraxial lighting, getting that rich red reflex. Again, with the red reflex, you have three-dimensional awareness, and you can see the visualization of the light and the lens pieces in 3 dimensions. But this is just a different way because now you're using an Endoilluminator to see the pieces directly at the tip of the chopper. And so you can see the rexus, you can see the lens pieces, you can know that you're sliding underneath the rexus edge with the chopper with tremendous confidence because you can actually see it directly with the Endoilluminator. Unfortunately, there is a whiteout phenomenon as I've played back and reviewed these videos, and they don't do justice as to what you actually see in real time during surgery. Just like if you look at the intricacies of a cracked glass or the jagged texture of a rock formation on a mountainside, you can see this in display with the cut edges of the lens fragments while disassembling with the chopper. It's actually quite beautiful and magical in a way. Dr. Nam states that he developed the iChopper primarily to help surgeons directly visualize the lens in the context of a small pupil. And I understand what he means. Since the iChopper tip is a light source, you can turn the tip towards whatever you want to see, and you can clearly visualize the lens fragments, the rexus edge, the iris, the posterior capsule, all the structures you need to see in order to remove the lens pieces safely without complications. But it is a very different way to do cataract surgery and would require an adjustment period in learning how to leverage its specific advantages compared to traditional techniques. Although I was able to adjust and successfully execute the double and cross chop techniques with the iChopper, I was less efficient with it because my technique works best with a right angle chopper, and the iChopper light source limits the amount of bend it can have. However, other techniques such as divide and conquer and stop and chop, other techniques that do not depend upon a right angle chopper, I can see there may be some applications and advantages to using the iChopper for an enhanced visualization for these techniques, especially under suboptimal visualization. I did also wonder if the iChopper could work well if there was a corneal scar, and Dr. Nam did say that it does work well in this context. So although I didn't have such a case on that day, I would be very interested in trying it in a case with a corneal scar. So this is my review of the Oculite iChopper, which functions both as a chopper and Endoilluminator to enhance visualization for cataract surgery, in particular for the small pupil cases. So I hope this was helpful to you, and I thank you for your attention.